In this edition of Generations, we talk Medicare Open Enrollment 2019 with Laura Cruz, who gives us the lowdown on what will be changing in 2020 when it comes to Medicare. Is your plan still working for you and at the price you can afford? And Judy Jencks from seniorcenterct.org talks about scams and being taken advantage of. Hello, I'm Brian Scott Smith and welcome to Generations, a new podcast for people of your generation. It's that time of year again for Medicare Open Enrollment, and if you're new to Medicare this year or a seasoned Medicare user, take a listen to our Medicare 101 segment. Joining us today on the Generations podcast is Laura Cruz, Director of Benefits Access from the Senior Resources Agency on Aging in Norwich. Laura, thank you for joining us on the podcast. Medicare. It's that time of year again.
It is.
And so you're going to talk us through, obviously, changes to Medicare. There's always changes happening. These are important. And people also need to understand, obviously, to look at their Medicare plans. Before we get into the weeds, as it were, just remind us what exactly Medicare is.
Oh, sure. So Medicare is the federal program where individuals who are becoming age 65, who have worked quarters in their lifetime, receive payroll deductions, who qualify for Medicare insurance. So it is a health insurance program that is for individuals who've worked at least 40 quarters, which is about 10 years of full-time employment, which does provide a slew of health insurance benefits.
And, of course, this is a federally funded program because a lot of people don't realize that Medicare is, or who funds Medicare.
Right. Medicare is 100% a federally funded insurance. It's not like Medicaid or employers' insurance that you may have had as you were working throughout your lifetime.
Now, of course, every year there are changes to
Absolutely.
Medicare, like most plans sort of thing. So we're going to talk about a few of those today. And you've also got some other things that you want to obviously make sure that we talk about as well, because it's all very important. Medicare comes in various sort of pieces, as it were. Pieces is probably the wrong word, but I mean parts, I believe.
Parts,
That's
exactly.
that's the word I was looking for. So 2020, some key changes we understand for Medicare. The standard Part B premium is projected to increase. Can you talk us around that a little bit?
Certainly. Typically, when there's a cost of living adjustment within your Social Security benefit, if the cost of living adjustment is, in my opinion, quite high, of course they're going to adjust the Medicare Part B premium as well. So for 2019, the Medicare standard premium is $135.50. With the cost of living adjustment that will happen in the year 2020, unfortunately, some individuals will find that, while you're getting a raise in your Social Security benefit, it might not be so much of a raise because the Part B premium is projected to increase to about $144.30 per month. So, you give some, take some, unfortunately.
And just remind us, Part B of Medicare, that covers what?
So your Medicare Part B is your medical insurance. This is your doctor's visits, outpatient services, labs, diagnostic imaging, durable medical equipment. And for individuals who say are diabetics, this is your diabetes testing supplies, Lancet devices, testing strips. That's typically after you're meeting a calendar year deductible. Those services are then covered 80% of the reasonable and customary amount through a Medicare participating provider.
And you mentioned the word deductible. Of course, wherever there is a premium, there's also a deductible somewhere along the line. So I understand also Part B, the deductible, there's going to be a change?
Yes, there's a calendar year deductible. So before Medicare Part B pays anything, the projected increase for next year for 2020 will be about $197. So individuals who don't have a supplemental policy that will help pick up that Part B deductible, right away going into the new year, as soon as you utilize your Medicare Part B services, you're going to be held responsible for at least the first $197 and then 20% after that.
Okay. Now, we're going a little bit backwards here because we're now going to talk about Part A premiums and associated, things like deductibles. Just talk to us about that because, again, some changes to Part A as well.
Right. So it's important to understand not everyone has to pay Part A premiums, and here's the reasons. In the beginning of the podcast, I mentioned if you worked enough quarters in your lifetime. 40 quarters works out to be about 10 years of full-time work. When you look at your paycheck stub, you see that you have deductions from your paycheck stub, and one of it is Medicare and FICA and all those wonderful things. Through your work history, you've actually paid your Part A premiums. So most of the individuals we help counsel do not owe a monthly Medicare Part A premium because they basically paid it already. However, Medicare is still available to individuals that may not have worked enough quarters in their lifetime. However, they have to purchase what's called Medicare Part A. And unfortunately, that is fairly expensive. For 2019, if you've had less than 31 work quarters, you're going to pay upwards to over $400 a month to have hospital insurance. But for most individuals, like I said, it's not often we run into individuals who have to pay a Medicare Part A premium. But there are things called a per benefit deductible with Medicare Part A. And when I say per benefit, you can kind of liking it towards like perhaps maybe each time you're admitted into the hospital, you may incur a deductible. It's a really complicated explanation of the Part A benefit because basically in order not to incur the Part A deductible again, you have to go 60 days without receiving any form of skilled level care. If you needed skilled level care prior to that 60 days, you're in the same benefit period. If it's been further than, more than 60 days, well then guess what? You're admitted back to the hospital, you're going to incur that deductible again. And that can be pricey. It's well over $1,300 for 2019. And I would imagine like every single year, the Part A deductible will rise. It happens every year.
Okay, all right. Now, another thing, we're going further into the alphabet here.
Sure.
Medigap plans C and F. Apparently, there's going to be some changes to that.
Right.
Talk us through that.
So Medigap C and F are wonderful plans. They're pricey, but they're wonderful. The reasons why is it will cover all your Medicare Part A and Part B deductibles, copays, and coinsurances. Connecticut had a nice caveat to that where individuals who were on Medicare due to a disability, so under the age of 65, they could purchase up to a Medigap Plan C. So they had Medicare primary, Medigap as their secondary, and basically had zero out-of-pocket expenses between the hospital and doctors. Plan F is still a great plan. Again, covers the same way as Medigap Plan C does, but you can choose a Plan F if you're age 65 or older. Again, covers all your Part A and Part B deductibles, copays, and coinsurances. However, due to one of the acts that recently passed, they decided that Medigap Plan C and F will no longer be made available to anyone who's becoming Medicare eligible January 2020 and obviously forward. Whomever is Medicare eligible basically December 2019 and prior will always have access to a Medigap C or an F. The rest of the plans that are available for those who are newly turning Medicare eligible next year, there'll be no plans available that will cover the Medicare Part B deductible. Now, the deductible is not huge. Like for next year, it's going to be $197. It basically means no matter who becomes Medicare eligible, no matter what supplemental plan you choose, you are going to be held liable for the first $197 of your medical expenses through Medicare. But again, I can't reiterate this enough. People who became Medicare eligible prior to will always have access to a Medigap C or an F.
Okay, so they're grandfathered in. It's just these new ones sort of,
Right.
from
Right.
December of this year. Okay,
Right.
that's a good thing to know. I'm wondering if now is a good time to also mention about the Medicare Savings
Yeah,
Program
absolutely.
as well. Talk
Yeah.
us through that because
Sure.
those are important things as well.
The Medicare Savings Program helps make Medicare affordable for individuals who are low to moderate income, especially in Connecticut. Connecticut has opted to have a very generous income limits for these programs. The Medicare Savings Program, if you do qualify, helps pay your Medicare Part B premium. That is the $135.50 now for this year, which projects to go up to the $144.30. It also, when we start talking about the prescription drug plans, it also provides assistance through what's called the Extra Help Program or the Low Income Subsidy Program that helps with your Medicare Part D premiums, deductibles, and copays. It's just a way to help lower costs. Now, as I said, Connecticut has a generous income limit with no asset test. So individuals that have, say, CD, stocks, bonds, cash on hand, that does not count towards program eligibility. And in Connecticut, If you're a single person, your gross monthly income can be as high as $2,560, or if you are married, you can have a combined income of $3,466, and you will qualify for the benefits that I just described. Lower income individuals may actually qualify for additional benefits, which if you give a shout out to the Choices program at Senior Resources, we have Choices counselors on hand that can really in-depth describe how the Medicare Savings Program will help you, how do you apply, and what should you expect once you become approved for the program.
Okay. Now, another thing I just wanted to touch on, because you were talking about obviously income in that particular savings program. I understand that the income brackets are on high income premium adjustments for Medicare's Part B and D, apparently going to be inflation adjusted for the first time. So that sounds good.
It is good because if you're a single person, and it all boils down to when you filed your taxes, how did you file them? Did you file single, or were you married filing jointly or not jointly? It all boils down to your marital status and how you filed. Since the inception of the prescription drug plans that came out back in 2006, and a little bit further, I believe, I don't know the exact date, but what happens is our government, CMS and the federal pieces decided that higher earners will pay more. And this includes not only your prescription drug plan premium, but also Medicare Part B as well. Historically, it's been for single filers. If you earned more than $85,000 from the previous 2-year tax return, so right now they're looking at 2017 tax returns to determine what your Part B premium is. If it was more than $85,000, you are going to get a nice note from Medicare and Social Security stating that we've determined you're a higher income earner. Here's what your Part B premium will be. And it goes up to, say, even $400,000. It all depends on where you fall in the income brackets. And for married couples, it was over $170,000. They would determine what your Part B premium would be. So now it seems like they're raising that just slightly. So if now you're a higher earner of $87,000 or more as a single individual, you will pay a higher Part B premium and a higher Part D premium as well. However, if you're $85,000 or so, good news, sounds like you'll no longer be required to pay that higher premium. But they do look at the 2 years ago filed tax return. So even if they raise it to the $87,000, I'm still thinking some people may still fall into that gap where they're going to end up owing the higher Part B premium.
Okay. So again, this is, and we're going to constantly reiterate that this is why you need to check your Medicare every year to make sure it's working correctly for you, because of all of these changes. Let's talk about Medicare Advantage enrollment. It's expected, they say, to continue to increase. Is that necessarily a good or a bad thing?
I think it's half-half, and it really depends on the Medicare beneficiary themselves. They really should look at all the options available to them. And what makes Medicare Advantage plans enticing is the original Medicare program has a lot of gaps in it as far as coverage for what people need. Things like routine dental, vision, and hearing is simply not covered by original Medicare. And that's very important to individuals. I think sometimes just having a nice, healthy mouth has an overall well-being, So Medicare Advantage plans most of them offer additional benefits or services that will help fill those gaps. By enrolling into a Medicare Advantage plan, though, is you're still part of the Medicare program. That does not go away. So folks, you still have to pay your Part A premium if you haven't worked enough quarters, and you must still pay your Part B premium as well in order to enroll into a Medicare Advantage plan. What happens, though, is you now get your Medicare benefits through a private insurance company, and there's about 7 of them in Connecticut that do business and offer Medicare Advantage plans. I would definitely take a peek at them, look to see if you're okay with the premiums that they may institute. Things you definitely want to look at is ensuring that all your doctors, labs, hospitals are within the network if you're choosing to enroll in what's called an HMO, because many of those have a tendency not to have any out-of-network benefits. So I just don't want anyone not having coverage by going to an out-of-network doctor. But there's a lot of bells and whistles to the plans. It really depends on your personal situation. So again, as you said, it is imperative, in my opinion, my professional opinion, to recheck your Medicare benefits each and every year to ensure that you're in a plan that you want to be in and that works for you.
I suppose the other thing to emphasize as well is if you're an active ager and you're still out there sort of like, traveling the world or doing a lot of travel, even if it's here inside the United States, you're going to want to make sure that, in the unfortunate event that maybe you fall ill or you need medical assistance, that you have, as I say, a plan that's going to have out of network for you, because otherwise you're going to be seeing a lot of costs racking up rather quickly.
Absolutely. So it's really important individuals know what they're signing up for. And again, just like you mentioned, if they're going to travel, I would suggest, if they're going to go the Medicare Advantage route, to sign up for either a PPO or a plan that says HMO/POS, which means point of service enrollment, which they have a tendency to have in and out of network benefits. You just make sure you're covered. That's what we want to ensure.
No, absolutely. So we're getting finally onto Part D.
Yay.
The prescription drug thing, which of course always causes lots of conversation. Obviously, we're seeing slight prescription drug prices continue to rise. We'll touch on that in a second. But explain to us a little bit more about this donut hole, because this becomes quite as a mind-bending sort of, oh, my God, am I there, am I not there? Right. What does this mean? Can you just try and simplify that a little bit for us?
I will try to. If you were very naive like me, and throughout the years, all we heard was the donut hole is closing, the donut hole is closing, it's closing. Well, if I hear that, I'm thinking it goes away. Well, when I started doing some research last year about how is 2020 going to affect us, I was honestly, and it was probably my own doing, I was actually quite surprised that while the terminology donut hole goes away, there's still a coverage gap. However, what a Medicare beneficiary needs to know is that, so you have what's called your initial coverage period. It means between you and your drug plan, once you pay a certain amount of money, okay, then you fall into what's called this coverage gap, formerly called the donut hole. Prior to the Affordable Care Act, individuals were having to pay 100% of all their costs while they fell into this abyss. Through the last several years, more and more subsidies were attached to this donut hole, which helped individuals not have to spend so much money out of their own pocket to get out of it. Well, what will happen for 2020 is, yes, there's still an initial coverage period. Once you meet that wonderful number, you then fall into the coverage gap, and you are basically held accountable for 25% total cost of the generic drug and the name brand drug. So for the generic drug, you pay 25%, and that 25% will help you get out of the donut hole. For a named brand medication, you pay 25%, and then there's also what's called a manufacturer discount that the drug makers provide, which equals to 70%. That 25% and the 70% of the name brand drug will help get you out of the donut hole as well. So essentially, you're getting a 95% credit for a name brand drug. Unfortunately, that's still quite a bit of money you still have to pay out of pocket with all these combined forces in place. And you'll still have to, with everything combined, still equal to about $6,350 before you get out of the coverage gap and you're in what's called the catastrophic coverage for the remainder of the year. It really depends on the drugs you're taking. Some people don't even get out of the deductible phase for their Part D plan. Some I will see will fall into the coverage gap and stay there for the remainder of the year. And again, really depending on the cost of your meds, some will go in and out of the coverage gap quickly and remain in the catastrophic cap for the remainder of the year. If you do get to the catastrophic cap, you're saving a lot of money, basically. You might not pay any more than about $8.95 for your drugs, or 5%, really whatever's higher. So if you're taking those types of medications, say like Humira, you're not going to pay $8.95 in the catastrophic cap. You'll pay about 5%, which is still going to be a couple $100 a month for the prescription. So it's imperative that individuals do look at their plans. We can help you at Choices. We'll screen all your drugs using the Medicare Plan Finder tool and help determine if you choose these types of plans, this is what your out-of-pocket cost may be for the entire year.
Just very finally, I want to touch upon the Medicare Plan Finder. Apparently, it's been upgraded for the first time in a decade. Is it useful? Are you finding it useful?
Bits and pieces. Some of it is. What I would suggest to Medicare beneficiaries is if you go to Medicare.gov, they've completely revamped the website, and it actually looks very nice. I think they've done very well with picking the colors. I would suggest that you create an account. So the reasons why is the thinking behind it, they did very well. It will help pull forward your subsidy status. So like if you're on the Medicare Savings Program, it will help guide you to this is what you're going to pay out of pocket for your drugs. But it will also pull forward drugs that you've had filled within the last 12 months. So it generates a list of prescriptions that you have purchased for basically 2019. This helps yourself. It helps Choices counselors help you with determining what is available out there for next year. Like there's 25 different drug plans available and multiple Medicare Advantage plans that are available. So my suggestion is, yes, please do. It's not hard to make it. They don't ask 100 type of security questions to, those silly questions that they have for you to prove your identity. I think there's just one, but it's fairly simple to do. If you need help, let us know. We'll help you. But when you're sitting down looking at this, it's nice because it pulls forward. Not so nice things is, and CMS is constantly updating this. They've taken a lot of information from the Choices counselors, the SHIP program, to say this is what's working, this is not what's working, and you need to fix it. So they finally just put together what it was going to cost to include the premium and drug costs. It was only able to be sorted the other day by what the drug costs would be. It didn't include the premium, so we actually had to do separate math to try to determine what a good plan might have been. So it has some nice features, but there's also some things that need to be worked on.
Okay, so what I'm hearing is obviously try it, but maybe come and see the Senior Resources Centre on Aging, because I believe your services are free, and obviously you can help people to
Absolutely.
To go through all of this. So if you're unsure, contact organisations like you, seek advice, get the best advice you possibly can for this, because
Absolutely.
obviously once that decision's made, you're locked in for another year.
Right. So you have the open enrollment period from October 15th to December 7th. That's anyone who's currently enrolled into Medicare that needs to make changes, whether it's your Medicare Advantage plan or a prescription drug plan, you want to try other things out. There is another enrollment period that begins January 1st and ends March 31st, but that is what's called the Medicare Advantage plan open enrollment period. Basically, you need to come into the new year on a Medicare Advantage plan in order to use it. But you can do multiple things like switch from one Medicare Advantage to another, or you can leave the Medicare Advantage plan and go back to original Medicare by selecting a prescription drug plan. So lots of little things for Medicare beneficiaries to know what's available to them.
Laura Cruz, as always, it's great talking to you. Thank you for stepping us through Medicare 101, because let's face it, we all need that help and advice because, of all these constant changes. And thanks for joining us again on the Generations podcast. Joining us as ever is Judy Jencks of seniorcenterct.org. Judy, lovely to see you.
Lovely to see you on this great fall day.
Indeed.
Yes.
The leaves are turning. So what ode do you have for us on this episode?
I have scams and taken advantage of.
Take it away.
So as the holidays approach, it almost becomes prime season for the scams to pop up. There is the feeling of goodwill and sharing. There's the end of year giving for tax purposes. And there are the schemes out there looking to catch you at your weakest moment. We've all heard of the lady getting taken advantage of for thousands of dollars. She goes to the bank, transfers her savings to the love of her life overseas. Well, that guy who convinced her to send her savings is trying to convince dozens of other ladies to send him money as well. And he laughs all the way to the bank. Now you wonder, how do I not fall victim to these scams? How do I keep my guard up? One big way is to not answer the phone when somebody you don't know calls you. When your phone rings and it's a number or name you don't know, let the phone continue to ring and have your answering machine answer. All of those unwanted calls, do not leave messages. Now you can block those numbers from calling you again and again. And if you don't know how to block numbers, ask a family member or friend to help you. Otherwise, just let it ring every time they call. Do not answer. Also, you can register for free with the National Do Not Call Registry. This can be done online at donotcall.gov or by calling 1-866-290-4236. And registrations do not expire. If you have previously registered your number, there is no reason to register again. You can also check to see if your number is already on the registry at donotcall.gov. Then there is junk mail. Don't even open it. Shred it. Remember, it's called junk mail for a very good reason. Do not send anyone money. Don't send money to those organizations that are out there doing mass mailings and asking for your hard-earned dollars. If you think it's an organization you want to help, research how much of every dollar they get goes to help their people they're asking you to help. Lots of times it's pennies. The rest of it goes to the campaign to raise the money. And if you want to help those less fortunate than you, consider giving locally. There are many different groups in your area doing marvelous work and can always find a great way to use your dollars. Often it's much more meaningful for us when we see how the agency that we gave money to is helping those in our neighborhood, our town, and our area.
It's absolutely true, and such great advice as well for sort of this time of year. I mean, scams happen, we know, throughout the year, but, towards the end of the year, holidays, it does seem to, step up, doesn't it?
Oh, it certainly does. And all you have to do is watch your mail.
Yeah.
And as your mail increases, you can sort of tell what season it is.
Yeah. You think about the telephone calls as well, great advice. I mean, it's funny, just as I was coming to our meeting here today to record this podcast, my phone lit up, my cell phone. However, it looks like, maybe the service provider or whoever is starting to put in more sort of mechanisms to try and sort of alert you, because it actually said possible scam call. Oh. So that's helpful. It's the first time I've seen that. And then sometimes it comes up, says marketing call. So at least you can, like you said, then just leave it. Because it's there's no number coming up. I'm not answering that if that is a marketing call. Let it go to voicemail. And like you said, they either will or they won't leave a message. And as you say, most of the time, no messages left. So
right. And I haven't had the experience you have, but last night I had San Juan, Puerto Rico call me. So, obviously that was a scam.
It is. It was interesting as well for me. I mean, I'm heading towards 50, but I keep getting telephone calls and voicemails saying about my student debt loan, and I don't have any. So even something like that, I mean, we're laughing about it, but again, it's... if you don't think about it,
yes.
I mean, even if you are an older person, some people still do have student, debt because,
yes.
I mean, it's unfortunately it's got large. So, you do just have to be, as you say, absolutely careful these days about who is calling you and just, do that screening process.
And one of the things that, sort of can trick us too is they'll tell us the warranty on our car is about to expire, and you can extend it, renew it. And sometimes, you just, oh yeah, I need to do that, without stopping and thinking, wait a minute, that warranty has expired a couple of years ago. Or no, my warranty is good for 100,000 miles, and I've only driven 50,000 miles. But, like I said, at your weakest moment, they can catch you off guard, and you can find yourself perhaps even talking to somebody to possibly renew, and then it pops, oh, wait a minute, I shouldn't be doing this. Get off the phone.
Yeah.
And don't think you need to be polite. Just hang up.
Great advice as always. Thank you for that information. And just quickly give us that telephone number again.
The number is 1-866-290-4236. And again, if you want to go online, go to donotcall.gov.
Brilliant stuff. Judy, as always, these are great pieces of advice. Thank you. We look forward to seeing you on the next episode.
Okay. Have a great day.
Thank you. That's all from this edition of Generations. Don't forget to visit seniorcenterct.org to find out what's going on in your neck of the woods. And if you want to send us a topic to talk about or want to be our guest on the podcast, drop us a line by visiting the seniorcenterct.org website. Go to the bottom of the homepage and click the How to Advertise with Us link to get in touch. From myself, Brian Scott Smith, thanks as always for listening. We'll catch you next time.